Recently, there is a lot of debate going related to psychiatric diagnosis. This is due to the fact that the DSM-5 is being developed recently. It's very interesting. The NIMH has also started a project titled RDoC, Research Domain Criteria, where they're trying to look at mental disorders in another way, looking at the different levels of brain system, like from genomics to molecular to circuit and to whole brain organization, relating them to different dimensions of mental functions, like negative dimensions, like anxiety and so on. For more than 10 years now, I have been trying to advance some kind of alternative diagnostic system for psychiatry, and I'm trying to do it, and I think it's original in the sense that it actually introduces other sciences into psychiatry, like the science of complex systems, complex nonlinear systems. And I think this is justified because the brain is a physical, nonlinear, complex system. Just for that reason, it justifies integrating these sciences in order to create such a brain-related theopathogenic pathologic system. And I call it I call my attempt here, I call it clinical brain profiling, and it is available on the web. You can actually download it. And at the introduction, I try to explain it better and relate it to the debate that is going around now related to the diagnostic system. And I start by saying, evolution or revolution? How does science evolve? Well, probably both. Data and descriptions of phenomena evolve over time in science, and then at a relevant threshold, a conceptual phase transition or revolution occurs. Psychiatric diagnosis awaits a paradigm shift, a revolution, to move from a descriptive phenomenological diagnostic system like the DSM to a valid brain-related ethiopathological diagnostic system. The DSM was successful in bringing reliability by specifying phenomenology of mental disorders. And now is the time for the great leap of creating a valid brain-related diagnostic system for mental disorders. The brain is a complex, nonlinear physical system, and as such, it can be understood by introducing insights and descriptions from the related complex system sciences such as nonlinear dynamics, neural network modeling, and computational neuroscience. By introducing these sciences to psychiatry, mental disorders can be reconceptualized as perturbations to the optimal balanced normal brain organization. In other words, mental functions characterize the optimal brain organization, while mental disorders arise from disturbances to that optimal brain organization. Because perturbation to brain organization can have multiple overlapping forms, then mental disorders are typically heterogeneous, forming a wide spectrum of variety of clinical manifestations, as most of you working in clinical settings know. Clinical brain profiling is the title given to this reformulation of mental disorders as brain disorders. Clinical brain profiling involves both evolution and revolution for psychiatric diagnosis. Evolution, because it is based on currently accepted clinical descriptions, and revolution because it offers a testable prediction for correlating each mental disorder to its relevant brain disturbance. This is achieved via an intermediate introduction of understanding of complex nonlinear physical systems of which the brain is a part. So actually, on one part you have, in the clinical brain profiling, you have the regular clinical phenomenology that you can rate, and then it is introduced into the clinical brain profiling matrix, which correlates it with a presumed testable prediction brain disturbances. This manual is divided into three sections. The introduction section, scientific background, and bedside usage. You can use it in the clinical setting with patients. These three parts are designed to provide a brief but in-depth description of clinical brain profiling and also practical instructions for bedside usage in the clinical and research settings. The introductions brings an overview of the ideas at the basis of clinical brain profiling. The introduction can suffice for a quick grasp of CBP and may offer the possibility to skip directly to the last part of the bedside usage of the manual. However, for a good understanding of clinical brain profiling, the middle section of scientific background is essential. This manual has three purposes. One, to introduce the language of nonlinear complex system dynamics into psychiatry. Two, to formulate a novel brain-related taxonomy for psychiatrists to use in everyday clinical practice. And three, to offer researchers a set of testable predictions focused to discover the causes, the etiology of mental disorders. Knowing the etiology of mental disorders will rapidly bring to the development of effective corrective interventions that will cure mental disorders. And this will be actually the ultimate revolution for psychiatry. So you can download clinical brain profiling. It's free. You can download it from the website titled Neuroanalysis. All you need to do is type neuroanalysis in any search engine. Once you are in the site of neuroanalysis, all you need to do is click on brain profiling or search for brain profiling, and there you can download a PDF manual and also a small Excel program that actually instructs you how to use clinical brain profiling in the clinical setting. And as mentioned in this paper, I hope that clinical brain profiling will first introduce to psychiatrists the idea, the notions, the concepts of nonlinear dynamics, like the brain is a nonlinear dynamic system. So this will turn psychiatrists to be more scientifically related to the brain. And then I hope that this will help create a formulation of brain-related taxonomy. Psychiatrists will start talking in the correct language, in the language of the brain disturbances. And naturally this will become a part of research, and it could be either validated or refuted. And hopefully this will advance psychiatry to the next step where we will really have a scientific, medical-related discipline that we don't have today.